Hey, this is Dr. C. Hope you're having a good day. Thanks for coming in, listening to my little excursion today into aspirin. Now, simple topic, right? One of the first things they teach in medical school, take 2 aspirin, call me in the morning. If you're better, you're a good doctor. If you're dead, well, hey, that's the way life goes, right? Let's talk a little bit about aspirin because it's not in the headlines anymore, obviously. It's all politics in the headlines now. So for a while it was in the headlines. Let's talk a little bit about the history of aspirin, huh? The old willow tree. It's in the bark of the willow tree. And been around for centuries. In fact, back in the old Egyptian papyrus, some of the archaeologists have read that, and they read those hieroglyphics and all, and apparently they used that willow tree bark. They would put it in some water, they used that distillated the water, and it reduced fever, which means that most likely it reduced inflammation. Great. But a lot of work's been done since the old Egyptians. So back roughly in 1853, that's coming up quite a ways. Remember, Galen, Hippocrates, they all mentioned using that willow bark. But in 1853, a fellow by the name of Charles Gerhardt, a German, is the first one that was able to synthesize acetyl salicylic acid, ASA. Now, that ASA, the acetyl salicylic acid, is what aspirin is. That's the chemical name. Not much was done about it for a while until, again, in Germany, a fellow by the name of Sabin was very interested in it, took a lot of the material from Charles Gerhardt and used it with the Bayer company, which is originally a German company, the Bayer aspirin. Been around a long time. And so it was used to help people during the time of the Spanish flu in 1918. The Germans took a patent out on it, and just like most patents, after about 10 years it ran up and the patent was gone. So what happened when Bayer got a hold of it? Well, Bayer wanted to market this. And now that they could produce it in the laboratory, they now wanted to look at how can we mass produce this and get it out onto the market and all. So they did it. Germany came to England, came to the United States. Everybody seemed to be looking at this wonder drug now, aspirin. Now, why was it called aspirin? Where did they get that name? Well, believe it or not, the A in the aspirin, that was because of the acetylation. They had to get that acetyl group on. That's A for acetylation. Spear came from the name for salicylic acid. That was the German name for salicylic acid, Spearsalsa. So aspir, and they put the IN at the end to make it sound more like a medication, aspirin. So that's how it came about. Now, before we go on to other interesting tidbits and all, on aspirin, why the number of milligrams? Why 81? That's a weird number of milligrams that many people are taking now for prophylaxis in the United States. 81. Where'd they come up with that? Well, you have to go into the old apothecary system. Now, they used to use the apothecary system as a unit of measurement in the pharmacy. And what one grain was equal to the length of a barley corn. A barley corn. So if you had 5 grains, it was 5 barley corns. But that's what they used. That's what they used. And so now, of course, since 1943, we use the metric system. The milligrams, grams, kilograms, all of those weights in the metric system. That's what we use since 1943. But you notice that 5 grains of the aspirin, 5 grains, was about 325 milligrams, which is what the standard regular aspirin, not the high dose aspirin, but the regular aspirin was. So a quarter of that was 81 milligrams. And that's the dose that's out there now, 81 milligrams. Okay, enough of that historical nonsense, right? So it's on the market now. Originally, it was called Panadol, but that has changed. That has changed as well, and it's now marketed. Many different types of aspirin on the market. You can have aspirin and caffeine, which is Anacin. You can have Excedrin, aspirin, caffeine, and Tylenol, acetaminophen. So all different types of aspirin are out there. You can get them enteric-coated as well, which don't dissolve until it hits the small intestine, supposedly to protect the stomach from bleeding and all. All different types of aspirin are out there. What does aspirin do? What is its purpose? Well, originally, it was for pain and inflammation. Okay. How does it work? Why is it good for pain and inflammation? Always, though, over age 18. Can't give it to kids because there's a thing called a Ray's syndrome, which can be fatal. So, not for kids. Tylenol for kids. Okay. So, what about this pain and inflammation now? Well, obviously, in the later 1900s, labs now were capable of working on a lot of these things, see what is behind the drugs. Why does it work? They found out that aspirin does reduce inflammation. And remember, inflammation, when you look at it and all, it's heat, redness, swelling, all those things, rubor, color, all that thing, signs of inflammation, all reduced with the use of aspirin. Okay? It's still used for pain and inflammation, used in rheumatology, rheumatoid arthritis, for example. That was one of the original indications for using aspirin. Well, again, back in roughly in the 1980s and all, they found out that aspirin has other effects as well. It affects the clotting system. Specifically, it affects the clumping of blood platelets. Now remember what blood platelets, that's one of the cells that are floating in your bloodstream. And the purpose of the blood platelet is to stop bleeding because they clump and they can plug up little holes. Okay? So they found out that aspirin has an effect on the COX-1 and COX-2. 1 and 2. And what is that? COX means cyclooxygenase. Now, the cyclooxygenase is an enzyme that is in the platelet. And it can lead, one of them, the COX, especially the COX-2, can lead to thromboxane. Now, the thromboxane is a prostaglandin that causes the platelets to clump. And the aspirin prevents the conversion of arachidonic acid to thromboxane. So it prevents clumping of the platelets. Now, when you take an aspirin, all the platelets in your body no longer are able to clump like they used to, regardless of the dosage. Now, we used to take 325 at first, but now 80 milligrams, and in England it's 100 milligrams. That dosage can do exactly the same thing, prevents clumping of the platelets. Obviously, the cardiologist got a hold of this data right away, and they told people, well, you can take it after you've had a heart attack, for example. You're now at higher risk to have more cardiovascular disease, and so you take it for secondary prevention of another heart attack. But then they took it one step further. Why not take it for primary prevention as well? In other words, before you get a heart attack, will this aspirin prevent a heart attack? Well, people were on it. I've personally been taking it since 1974. 50 years I've been taking 81 milligram. Well, I started at 325, but I put it down to 81, which I'm taking on a daily basis. Now remember, I'm 84. So we're going to go into that a little bit more. So those are the two things, primary reasons why people take the aspirin. One is for pain and inflammation, reduce that. Number two, to prevent platelet clotting, platelet aggregation, which seems to decrease the incidence then of heart attacks, strokes, in other words, other vascular disease. Okay. Are there other things that aspirin does? Well, one of the big things is that it can lower your risk of colorectal cancer. Wow! Especially if you have started the aspirin before age 70. Seems that once you are 70 years old, the aspirin doesn't work as well preventing the colorectal cancer. We have a whole show on colorectal cancer. You may have seen it. But nevertheless, that's the reason. What else? What other reasons besides colorectal cancer? The aspirin decreases the incidence of colorectal cancer by 24%. Not bad. It decreases deaths from colorectal cancer by up to 35%. Now that's significant. That's a significant number. So that is the third usage of aspirin. Now there are many, many different studies that are out there using aspirin. Number one, prevention of or healing of venous ulcers in the legs. Now the reason that it does seem to heal, and it heals them a lot faster than people who have not been on the aspirin, because it does inhibit the platelets from plugging up the little blood vessels that are coming in to try to heal that wound. What else? What else? Remember the first thing, if you have chest pain and you may have a heart attack, what do they tell you? Take an aspirin first. That's what the EMTs give you. Take that aspirin. So it's using it for the heart attack first aid as well. They've even tried to use it topically in acne prevention. Acne, because acne is an inflammatory condition in the little oil glands in the skin of the face and on the body. And if you can reduce the inflammation, you may be able to heal your acne a little faster. They're using it for a number of different things as well. They have a topical that you can apply to, say, an insect bite or a sting. Apply that, reduces the inflammation, and doesn't bother you as much. We also use it in gardens, keeps the flowers blooming. Diabetics especially need to have the aspirin prophylaxis because the diabetics have a lot more problems with arteriosclerosis and with their platelets. So these are all different ways now that aspirin is being used. Now there are contraindications to using aspirin as well. I mentioned that you don't take it up to age 18 because of the possibility of what's called Reyes syndrome, R-E-Y-E-S, Reyes syndrome, which can be fatal. So we don't see the kids getting the aspirin. People who have bleeding disorders like hemophilia and all, they cannot take aspirin. People who have bad asthma can't take aspirin. People who have peptic ulcer disease, known to bleed, no aspirin. No bleeding disorders from peptic ulcer disease. People who have significant liver or kidney disease should not be using aspirin as well. What are some of the side effects? We told you about the potential benefits and all. What are some of the side effects from taking aspirin? Well, there's a thing called analgesic nephropathy. In other words, it can affect your kidney function if you're using a significant amount of aspirin daily. It can also induce some liver function disorders. It can promote gastric ulcers, stomach ulcers. One of the earliest signs of overdose of aspirin is a buzzing in your ears, tinnitus it's called. You get tinnitus and you're on aspirin, bang, you come right off of that. You can also have an allergy. You can get an allergy to anything, and you can have an allergy to aspirin as well. Mainly it's the drug interactions too. You have to have a cardiologist tell you, if you're on this, don't take aspirin because this is a blood thinner. Aspirin prevents platelet clotting, and the two together are not good. Not good. Okay. Now, let's go into things a little bit more. I had mentioned to you that we take aspirin for primary and secondary prevention of arteriosclerotic heart disease. Primary prevention means you've never had heart attack or a stroke or any cardiac disease. Secondary means you've had one of them or all of them, God forbid, and you're taking it for prevention of a second heart attack or stroke. Okay. How long do you take it for? Okay. Seems like a simple question. It is a simple question with no simple answer. Now, I mentioned I'm 84. I've taken it for 50 years. About 4 years ago, a study came out, and it had the blessing of the American Heart Association, American College of Cardiology. They said if you're over 70, the risks of a bleed in the GI tract or wherever are greater than the benefits that you're going to get from taking the aspirin. And so the bottom line was, don't prescribe aspirin over age 70. Did they tell you how to stop it? No. Leave that up to your primary doctor. Okay. That's the usual way they leave it up to your primary. That's what they do now when they market the drugs. Pharmaceuticals market the drugs directly to people over TV and all. Some of you can't even pronounce the names. Don't get me into that. Okay. So you got three organizations now telling you what to do with aspirin. The Heart Association, College of Cardiology, and the U.S. Preventative Services Task Force. Three organizations telling you what to do. Now, secondary prevention, no argument there. Although they do seem to tend to stop the aspirin over age 70. Now, for primary prevention, there's no question from the Heart Association or the College of Surgeons, don't prescribe it over age 70. That's not what the papers say. And these reporters will now report out, oh, you shouldn't take aspirin over age 70. That's not what they said. You idiot. They didn't say that. They said don't prescribe it after that age. So, should I, at age 84, taking it for 50 years, should I stop cold turkey? Should I wean myself off? How do you wean off of aspirin? Remember, when you take an aspirin, all your platelets are coated by that aspirin, all of them, in your body. But a platelet only lives for 7 days. 7 days, that's its lifespan. So every day you get a turnover with new platelets coming in, old platelets trapped by the spleen, and out they go. So if I waited 7 days off aspirin, all my platelets now would be free of that clotting effect. All of them. That has implications. Let's say you're going to go for surgery or something. How long are you supposed to be off of aspirin? Well, it varies. Because they don't know. But they won't tell you they don't know. They're too stupid. They have to follow some algorithm somewhere that somebody else, some artificial intelligence has printed out for them. That's what they do. That's medicine nowadays. You got to understand that. How long do you stay off of it? Well, some very good studies have been done. If I don't take aspirin, say for, 3 days, 3 days off of aspirin, that means that roughly, 50% or so of my platelets are still active, still have that aspirin effect. I can still clot. So 3 days seems reasonable. After about 5 or 6 days, all the blood clotting studies involving platelets are normal again. So that gives you an idea of how long you need to be off of aspirin. Now, getting back to the age thing. My primary wanted to take me off. I said, okay, how? Cold turkey? Yeah. Give me the. Let me give you an example of a study that was done in Sweden. Now, Sweden has, that's a very, very, well, you might call them one of the progressive type of liberal countries. And they have a great database. And they took the database from over 600,000 residents who were on aspirin. 600,000 of them. And people with the different age groups and all. And they had some people, almost 30,000 of them, come off of aspirin, and another 30,000 who didn't. Of those people who came off of aspirin, in 1 year's time, they had a 37% increase in cardiovascular problems. 37% increase, simply by coming off of that aspirin. So, Again, I asked my primary, knowing that, you still want to take me off of aspirin? Okay. I'm still on aspirin, incidentally. So that is one of the major questions that people have nowadays. Not that there aren't a number of different things associated with aspirin. What about the cancer of the bowel, of the colon rectal cancer? They're studying that now to see if is there an increase in colon rectal cancer on people who have been taken off of their aspirin. So just like that Swedish study, we're going to get some answers on that very soon. Very soon. So, at any rate, it is very interesting. Oh, incidentally, we didn't talk about the difference between men and women with aspirin. That's also a good study. There were a couple of big studies done. One was both of them done at Harvard. And one of them had a Harvard male study, and the other were nurses, all women. And so they studied the aspirin effect on both. So was there a big difference? Well, yes, there was. The women, for example, had a decrease in their, by taking aspirin, a decrease in their strokes and a decrease in colon cancer. The men, on the other hand, had a decrease when they took aspirin, a decrease in their heart attacks, strokes, and deaths. So a big difference in the two groups, men and women. Okay. I think we've dealt with a number of different issues related to aspirin. You have to make up your own mind about it, and don't always rely on your primary to know exactly what to do. This Dr. C. Take 2 aspirin, call me in the morning.